Hello friends, I am Dr. Kshitij Dubey, a well-wisher of your heart. At times we all have to face some unfortunate events in our life. They are unfortunate, but clearly they are not in our hands, not in our control. In such difficult situations, the most important thing which we need to understand is not to panic, but to go to a clinician or a doctor who is known to practice evidence-based medicine, who follows the scientifically proven protocols. It becomes far more easier and safer for the patients. In an unfortunate event of a heart attack, let us see what needs to be done and understand.
Dealing with heart surgery is simple and easy. Let's have an overview of heart issues and medical treatments. If you had chest pain, first consult the doctor. Then, according to their suggestion, first go for ECG test. According to the reports, if the ECG is normal, the next step is the TMT test. And if the TMT test is normal, your heart can be cured by the medication. If the ECG found is abnormal, angiography will be the next step. Based on the angiography report, there would be 3 conditions. The first condition, your heart has chances of less than 70% blockages in 1 or 3 arteries, and it can recover by medication. In the second condition, your heart has chances of more than 70% blockages in 1 or 2 arteries. So, the angioplasty treatment is applied to clear the blockages. In the third condition, your heart has chances of more than 70% blockages in multiple arteries. So, 3 treatment options will be applicable: CABG, open heart surgery; MICS, minimally invasive cardiac surgery; and conventional surgery. And if you have breathlessness, so the first step is to go for chest X-ray. Depending on the reports, if it is normal, then by pulmonary functions and then by medication, we can resolve the issue. If the reports have an enlarged size of the heart, the echocardiography test is required. If this test is normal based on the TMT test, the medication will resolve the issue. But if the echocardiography report is abnormal, there are definite chances of a valve issue or hole in the heart, then MICS or conventional surgery would be the treatment option. Dealing with heart surgery is as simple as that. To know more about open heart, minimally invasive cardiac surgery, and conventional surgery, let's consult with Dr. Kshitij Dubey.
So friends, I hope that I have kept it simple. I have made it clear. I just want you not to panic in these difficult situations and deal with it properly. I want to befriend by heart with your heart.